Welcome to Nurse Minute. My name is Brenda Marks. I'm Product Manager and Clinical Educator with Surface Medical. It is my pleasure to introduce Mary McGoldrick. We are honored to have Mary join us as her experience and expertise is truly remarkable. Mary is a home care and hospice consultant for Home Health Systems, Inc. With over 35 years experience in healthcare, Mary served 12 years as a home care and hospice surveyor for the Joint Commission and 10 years as an educator and adjunct professor at Mercer University's Graduate School of Business and Economics in Atlanta, Georgia. Mary is an author of more than 90 published articles and several books and a published expert with the Infusion Nurses Society. Mary has served on the CDC HICPAC 8-PIC committee to develop surveillance definitions for the home health and hospice industry and the Joint Commission's expert advisory panel for updating infection prevention and control standards. Good morning, Mary. Thank you so much for joining us.
Good morning, Brenda.
My first question for you, Mary, is as a former Joint Commission surveyor, what types of facilities did you survey?
Primarily, I would survey any types of programs that were providing services in the home setting. So that would be any home health agencies, hospice, home infusion, private duty services, and durable medical equipment providers.
So what would you say are the biggest differences in surveying home care or hospice settings, versus a hospital?
I would say the biggest difference is really the actual care setting, because providing care in a home care setting is very different than providing care in a hospital environment. In the home, we as healthcare providers have minimal control over the home environment. We're sort of guests going into someone's home, and in many of the homes, there's like no housekeeping department that we can call, and many of the homes that, the staff have to go into or bring medical equipment into are really not the best environments, that can be infested with pests, have, animals that are not being cleaned up after. It's really a very different environment than providing care in a hospital. So there are definitely differences, and people do the best they can, who are very sick in providing care in the home.
So I'm not sure, exactly what type of surfaces would be used in a home care setting, versus a hospice setting. But how often did you find damage, soft surfaces, and where would you find the highest rates of damage?
Actually, I would say that the biggest problem from a home care perspective has to do with the medical mattresses that are being delivered by the durable medical equipment companies out to the patients in the home. For example, once patients become bedbound, they typically need to have a hospital bed delivered to their home, and certainly many of the hospices in providing patients with their medical equipment deliver beds out to patients' homes. So when I am working with either durable medical equipment providers or especially hospice providers, one of the things that I do look at very closely is the medical equipment that's being distributed to the patients, and to make sure that it's really in the best condition it can be. So one of the things that I do is when I go to conduct mock surveys for DME providers, I actually go into their warehouse and I look at the medical mattresses that are being stored and inventoried. And one of the things that I'm looking for is the integrity of the mattresses that they, quote, label as ready for patient use. Those are the ones I'm primarily looking at to make sure that the surfaces are intact, that, these are really going to protect the patient in the best manner. So the other thing, too, when I'm out with, again, DME providers, I literally climb up into the back of the trucks to DME providers, and I look at the mattresses that are being stored, prior to being delivered to the patients, to look for the integrity of the mattresses. And I hate to say it, but they're when I'm out there, I do see problems, is equipment that's labeled ready for patient use or on trucks ready to be delivered out to patients' homes, and there are rips and tears, and that really would not meet the criteria as being ready for patient use, but I do see that pretty often.
So, Mary, when you're climbing up on the back of a truck Good for you. What do you do when you find the damage?
Well, I look very closely and I identify that and I sort of bring that to the driver's attention because they're the ones that are actually taking the equipment out of the warehouse and putting it on the back of the truck and, securing it to take out to deliver to a patient's home. So the first thing I always do is ask the driver, were you aware that there was this damage to this equipment? And a lot of times, the drivers, they're really not, if they see it's in the area that's labeled, quote, as, ready for patient use, they're just assuming that the equipment is ready for patient use, and they pick it up and they put it in the back of the truck. So they're really not doing the level of inspection that is in the back of the truck. But usually once I make them aware of that problem, if you will, they're not taking that out to patients' homes. They'll get another one replaced, and they'll make sure that's not delivered because they usually keep extra stock in the back of the van. So it really all begins back in the warehouse with prevention, in making sure that when the drivers are bringing equipment back to the warehouse for it to be reprocessed and cleaned and inspected and all of that they're really doing a good job in making sure that equipment that does need to be repaired is not just being cleaned and disinfected and put back on the shelf is ready for patient use, that it truly is being inspected thoroughly and inventoried and managed carefully.
And would you say, Mary, when you're in a hospice setting, how often would you find damage there?
In a hospital, hospice can be provided in a couple of different care settings. The majority of hospice care actually is provided in the home setting, so that's where the DME providers are going to be bringing hospital beds into someone's home to help the caregivers better care for a patient through their dying process. And then there's also hospice care that is provided in, assisted living facilities, nursing homes, and other facility-based care, if you will. So I can't give you a particular percentage or anything. I would say it's probably, I don't find it as common in facility-based hospice care, if you will, versus some of the home care. I do find damage in facilities. I absolutely do, but perhaps not as common.
Mary, we always say that damaged equipment is everyone's concern and that everyone should report any damage they see. But in a facility setting, who do you think should be responsible for addressing the problem?
Brenda, as you mentioned, damaged equipment is everyone's concern, as is preventing infection is everyone's responsibility. So I think it really starts even at the aid level, the individual who is out, in the patient's room that's changing linen. It's sort of, if you see something, you need to say something. If they see any damage to the equipment, to the mattresses that are in the patient's rooms, that they need to make somebody aware so that that particular mattress can be replaced, so that there's not even a potential of the patient's body fluids leaking through and potentially placing another patient at risk for infection. It's also the responsibility of the department that is warehousing the mattresses to make sure that they're truly inspecting those and looking at them carefully, inventorying them, and making sure that damaged mattresses are never on the patient's bed in their rooms.
I think those are very wise words. If you see something, say something. I like that. Mm-hmm. Mary, do you have any other thoughts or suggestions for us with respect to damaged mattresses or other soft surfaces?
I would say that prevention is really the most important component with this. By virtue of using the equipment and just having normal wear and tear, things are going to happen to the equipment. But it's really important that the equipment, especially the medical mattresses, that those surfaces are really inspected carefully after patient use, and at the time that the slightest worn is being noticed, that other individuals need to be notified of this potential breach in the integrity of the equipment so that it can be repaired or, other processes put in place so that we're not putting our patients at risk for infection, because that's really what's most important.
I think you're absolutely correct, and that's a very valuable suggestion for everyone. Mary, I want to thank you so much for your time this morning, and hopefully we will speak again in the near future. You take care.
Great. Thank you, Brenda.
If you have any questions for Mary or would like more information on a mattress inspection and repair program, please contact us via email.